My name is Tamara Shrianant, and I am a physician assistant at North Texas Diabetes and Endocrinology, working with Dr. Wasim Haq. This video is part of an informational series covering different medications for diabetes. Today, we will be talking about Trulicity, which is part of the GLP-1 agonist family of medications. After you eat food, the small intestine secretes GLP-1 in response to food. This hormone acts in the pancreas to stimulate insulin secretion and to suppress glucagon secretion. These two actions help to maintain a normal blood glucose. They also slow the emptying of the stomach's contents into the intestines, which helps to lower blood glucose after meals. These medications augment the actions of naturally occurring GLP-1 in the body. GLP-1 agonists are great agents for those who are overweight or obese. Overweight or obese patients generally lose, on average, about 6.5 pounds. They also have cardiovascular benefits, so they are an excellent choice for those at risk or with known heart disease. These meds are also effective at controlling blood glucose with a low risk of development of hypoglycemia. As there is some possible benefit on beta cell function, these meds are an excellent choice for those with relatively early diagnosed type 2 diabetes. How and when to take Trulicity. Generally, your healthcare provider will start the medication at the lowest dose of 0.75 milligrams once per week at any time of day. After about 6 to 12 weeks, your healthcare provider will reassess your blood glucose log and/or your hemoglobin A1C and make a decision about whether or not the dose needs to be increased to 1.5 milligrams once per week. The dose may need to be adjusted if you develop intense GI side effects such as nausea or diarrhea.
Today I'll be showing you how to use the Trulicity pen. So first I'll start off by going over the parts of the pen. So this is a Trulicity pen. Here is the safety base cap. This is the body of the pen and it includes the medication and the needle. And this is the dial that you'll be using to switch from the red locked position to the green unlocked position. And this is the button you'll be pressing in order to deliver the medication. So now I will be demonstrating how to use the pen. First, you'll start off by selecting your injection site. For you, that will be your abdomen or the side of your thigh, and I will be demonstrating this on this surface. So first, you'll want to start off by swabbing the injection site with an alcohol swab. And now you want to wait until that's dry. Next, you'll be removing the gray safety base cap from the pen, and then switching the position of the dial from the red locked position to the green unlocked position. Now, you will place the pen perpendicularly against your injection site, and then you can press the button. You want to wait for 2 clicks until you remove the pen from the injection site. So that was the second click, so now you may safely remove the pen from the injection site. And since this is a single-use pen, you may dispose of it in a safety sharps container.
This slide demonstrates all the locations for a Trulicity injection, including your abdomen, arms, thighs, and above the buttocks. Remember to rotate your injection sites. Storage and handling of Trulicity. Trulicity should be stored in a refrigerator. It can remain at room temp for up to 14 days. Please keep out of direct heat and light and dispose in a puncture-resistant sharps container when done. Who should not take a GLP-1 agonist? These are not good options for patients with a history of pancreatitis. These agents are also contraindicated in patients with a personal or family history of medullary thyroid cancer, which is a very uncommon type of thyroid cancer, or multiple endocrine neoplasia too. These agents are also not good for patients with severe GERD or gastroparesis, or those at risk for fluid depletion. The most common side effects of this class of medications are generally gastrointestinal, which include nausea, vomiting, diarrhea, and heartburn. Generally, GI side effects get better over time. However, if a patient reports severe abdominal pain or vomiting, we do ask that they immediately discontinue these medications, as there is a very rare risk of development of pancreatitis. When combined with some other medications, such as sulfonylureas, glipizide, glyburide, glimepiride, or insulins, there is also a risk of hypoglycemia, or low blood glucose. For injectables, there is a potential for injection site reactions. Potential advantages for the GLP-1 class of medications are numerous. One of the greatest benefits is weight loss and appetite suppression. GLP-1 medications help you feel full after a meal, which causes you to eat less. This is especially helpful in glycemic control, as weight loss is a mainstay of diabetes management. For those at risk for hypoglycemia, GLP-1 agonists act only when the blood glucose is elevated. Unless they are combined with other agents, as discussed earlier, they generally do not cause hypoglycemia. Studies have also demonstrated a cardiovascular or heart benefit of these agents. Type 2 diabetes is a progressive disease characterized by insulin resistance and a decrease in the pancreatic beta cell function. There is some data that GLP-1 agonists may help prevent further beta cell decline, which means that they may prevent progression of diabetes. Some of the most common frequently asked questions around Trulicity include travel with Trulicity. You may store your pen at room temperature for up to 14 days, which means as long as you're traveling and keeping it with you on your carry-on luggage away from direct heat and light, you should be safe to take Trulicity with you on your next trip. What if you miss a dose? If there are 3 or more days or 72 hours until your next Trulicity day, take the mixed dose. Skip the missed dose if there are less than 3 days remaining and take your next dose on your regularly scheduled Trulicity day. Do not take 2 doses of Trulicity within 3 days of each other. This slide includes a lot of detailed information. Please be sure to pause the slideshow and take a picture so that if you have any questions, you will have this as a resource. In conclusion, Trulicity can be used as a potential first or second-line agent in the management of diabetes. It is also associated with weight loss and cardiovascular or heart benefits. These are 2 very important elements in glycemic control. Please remember, this video is only intended to serve for informational purposes only. It is not to replace individualized evaluation and management. Please be sure to contact your healthcare provider to address your unique needs. Good luck, and thanks again for joining us.